I've always had an interest in chronic pain patients and non-English speaking patients. It's a population that is not very popular, and a lot of people kind of cringe when they hear that a patient is coming to them that has chronic pain or chronic symptoms because they're typically so difficult to manage. My name is Erica Torres, and I'm a registered nurse at the Mayo Clinic Pain Rehabilitation Center. Kind of the first person that the patient meets whenever they come to the program. We teach patients how to deal with anxiety, with stress, with anger, with relationships, how to grieve the person that you used to be. We always want to get a really good idea of what that person is about. What are they struggling with, to help figure out how we can create steps to help them move closer towards those goals and get back to a normal life. One of the big concepts we teach them is that hurt does not equal harm. So even though your body hurts and it's sending you that message in your brain, if you look at an X-ray or at an MRI, you might not see anything wrong. And that's because of that pain message that's sending that louder signal. And that's called central sensitization. There's a lot of different symptoms that patients have, chronic symptoms that are due to central sensitization. And that we found with research and the pain rehabilitation program is that when we teach patients how to approach their management different and how to function differently, it actually helps with that rewiring and it calms that message to the brain. When I finally started working in the program for about a year, I was like, you know what? These are things that my mom needs because she has scoliosis and she's always complaining of back pain, doing different things to try to fix her back pain. So we finally convinced her to do the program.
Apago las habichuelas. All right, you guys ready to eat?
Our family is from Puerto Rico, and we're very much a culture that when somebody's ill, you want to care for them. You want to do things for them so that they're not straining. And this program is doing the exact opposite. We're teaching patients how to become independent in their care. And sometimes family members see that as being pushed away or their caring being refused or put down. So kind of teaching them that that's okay and that doesn't mean that they don't love you or that you don't love them is a very difficult concept to convey to Hispanic patients. I actually have a picture of a great aunt that was a nurse, and I think that was my first picture of what a nurse was, just that person that took care of people and helped them get back to health. I remember hearing her tell stories about when she worked at the hospital, seeing my mom's family just work so hard for all of them to get degrees. That kind of set that foundation of the importance of getting an education to be able to progress as a family. That kind of led me into that path of course I'm gonna go to college. And then when I was in college, I got pregnant with my first son, and then I had to make a decision of either going to medical school or staying in Jacksonville, and I picked nursing so I could stay in Jacksonville close to my family. If I were to choose my career, I would pick nursing again. I feel like it's a perfect fit. There's a lot of moments that you have with patients where you touch on things that they probably haven't talked to anybody about, and they see that you really care about them. And that's how they kind of grab on to, oh wow, these people really know what they're doing. They really do care about me. They really do want me to succeed. I think they see that sincerity. I feel like that really empowers them.